Unfortunately, none of us who do breast surgery can ever tell our patients we don't have complications. And I've received a question about complications following a mastectomy in a patient who did not have reconstruction. Needless to say, the more complex the surgery is, if you have complications, then those complications may be more complex as well. But let's just focus in on a patient who had a mastectomy, developed a seroma. What's a seroma? Seroma is a collection of fluid underneath the flaps that were lifted up for the mastectomy, and then went on to have an infection, and it really gets complicated from that point forward. Fortunately, complications after a mastectomy are not very common. The two most common things that we see are a buildup of fluid underneath the flaps. Generally, we can use ultrasound to guide aspirating that fluid out, get the skin flaps to stick back down, and in general, that's the easy way of having to treat a seroma, which is not uncommon. Now, if that is then suddenly complicated with an infection, then the situation becomes a little more complex. And by that I mean, obviously the patient needs to be on antibiotics. If the patient did have reconstruction and there's an implant in there, unfortunately sometimes the tissue expander or implant has to be removed. Now, one of the great worries about any complications from mastectomy is the worry about losing range of motion of the shoulder. So what we've got to do here is focus on first things first. You want to correct the seroma. You want to correct, obviously, the infection. And then once everything is healed up, then working with a physical therapist on the range of motion of the shoulder, elbow, and what have you is really important. Now, a word of caution. If you're a patient who's had your lymph nodes removed, you're losing some of the local immunity or fighting infection in the area where the mastectomy was. So the chance of having an infection is increased some. This is particularly true if you now couple that with radiation therapy, because the radiation therapy damages the skin. You can have just the simplest bacteria on the skin get underneath the skin and then end up with a subsequent cellulitis, is the medical term. So my plea always is work with a multidisciplinary team, particularly work on the range of motion after you're healed up. Some of the simple things you can do in the interim is like a tennis racket swing, moving your arm around to keep your rotator cuff loose in the interim. But then once everything is fully healed up, what's really important is working with a physical therapist to regain your full range of motion. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.